the criminalization of drugs, I think, I'm sure other people will say this, you know, we'll look back at these days as the dark ages of drug policy, the stigmatization that the war on drugs has caused people around the world. If things stay the same in this field, they're going to get worse, guaranteed. The police will tell us that, you know what, 10 years ago there were, you know, 10 or 14 organized crime groups in DC, and now I think we're up to 139. And they make a big deal about this. Wow, look what's happening. Well, figure it out. Figure it out. Look at the cash flow. You know, look at these 23-year-old kids from Surrey and Abbotsford. Yeah, driving Hummers. And 30 years ago, I might be smoking because I'm nervous. Half of you would be smoking. There'd be an ashtray right here on the desk, and we'd just all be having a great time. We'd look like academics, you know. We'd be smoking cigarettes, and it's hard to believe that world existed. We got on planes. We smoked everywhere, and I mostly bummed smokes.
Actually, in SSDP, one of their T-shirts, it's my absolute favorite SSDP T-shirt, was it has a picture of a guy talking to his parents, and it says, "Have you talked to your parents about drugs?" Because that's what we need, this sort of movement up. Being
in Vancouver, I have to say, it's very inspirational, but it's really great that you know, our cousins to the north, you know, can sort of lead the way for us. And yeah, you guys are, you know, you're kind of like you know, the sort of cousin that we have a secret crush on, and we kind of want to make out with you guys, but we're not supposed to talk about socialism. And so, you know, but we'll get there, you know.
My name's Kirk Tusaw. I'm a barrister. I'm also the founder and executive director of an organization called Drug Prohibition Foundation, which is working towards a regulatory model for cannabis. And I'm going to focus my remarks today on cannabis. I've been active in attempting to reform cannabis laws in the United States and Canada really since high school. My first sort of act in that regard was to hang a legalized marijuana now poster in my high school at age 16 when the governor was coming to visit. An act of free speech that caused some consternation at the school. Cannabis prohibition in particular affects more people in this country directly than any of the other drug prohibitions, because there's, quite frankly, just more people using cannabis. There's some 700,000 Canadians that use cannabis on a daily basis. There's another 1.3 million Canadians that use cannabis on a weekly basis. Last year we set a record for cannabis arrests for simple possession at 50,000 arrests. Cannabis is dramatically safer than alcohol. Dramatically safer than alcohol. It's not even in the same ballpark. You know, we have to continue to advocate at an international level, at the UN level, to minimize the influence of the United States in crafting worldwide drug policy. The reality is they have it wrong, and they're the worst of the worst in terms of foisting their views on the rest of the world. At least they have been so far. I mean, for example, are you going to listen to America on banking policy? I don't think so. And so why should we be listening to them on drug policy?
Map of inequality between different people, and then you see connections between the maps. That's the study of public health. So we need public health because it focuses on groups, communities, and all of society. It has advantages. It deals with prevention, treatment, and education. It's accountable and very goal-oriented, and it specifies specific health approaches. It also deals with this incredibly juicy topic that I'm going to talk more about this afternoon, which is social capital, the bonds between people. Very important part of this discussion. It's a tool of social cohesion. That's how we regulate most or many behaviors in our society. Shared responsibility works quite well for us. So we need them both. Public health needs human rights, and human rights need public health. The human rights model is global in its acceptance. Even countries that brutally kill their citizens in the streets still play lip service to this particular model. It is universal. We would want to decrease this, increase this, and perhaps leave that one alone. All drugs are different. And what we would need to have is appropriate regulatory models that matched the different drugs. This is important for our children. So in a new model, to protect our children, would have a foundation in both public health and human rights, would acknowledge a variety of use patterns and drug attributes, matching the harmfulness of drug type to regulatory model, and use the least restrictive process to actually reduce the harms of drug. Thank you.
Law enforcement against prohibition is a group of cops, judges, prosecutors, correctional officers, and our goal, simply put, is to end the war on drugs. So we don't support drug use or abuse. We don't support or encourage breaking the law, but we recognize that a system of drug regulation would be less harmful and more ethical than drug prohibition. And there's lots of evidence to support this. You know, over the last 40 years, we've seen heavy enforcement from law enforcement agencies around the world. And in spite of that, drugs today are cheaper, they're more potent, and they're more available than ever before. So if the goal of the war on drugs is to reduce any of those things, those goals have not been met. So we need to think about alternative solutions that don't involve prohibiting these substances, but actually focus more on regulating them for adults. There's a strong parallel between the situation with drug prohibition today and alcohol prohibition in the 1920s in the United States. And just like alcohol prohibition in the United States brought us stronger forms of alcohol and gang violence over control of the market, that's exactly what we're seeing in the United States and Canada today. See, we all want the same thing. We want a public policy that results in the lowest level of drug use and the lowest level of harms from drugs. And if you actually look at the evidence and you take the time to learn about it, then it becomes clear that the unintended consequences of drug prohibition actually increase drug use, increase addiction, increase crime, death, and disease.
We've got a lot of food for thought here. The post-prohibitive space is going to be really exciting. So I'd like to use this opportunity to really discuss it. This is not a space for ranting. This is a space for constructive, creative, and provocative ideas. Everyone agree? Excellent. So who would like to go first? Hugh?
Every major piece of social change that's happened in North America in the last 100 years, whether it be gay rights, women's rights, the minority rights, etc., has all taken place through the courts. In other words, we're not, I think with drug policy being such a hot topic, a hot potato topic, we're not going to see our governments suddenly come to this eureka moment where they realize that things are going badly and changing policy. We haven't seen a serious policy consideration within North America at all, and we're not going to see the kind of Portuguese experiment, unfortunately, under these circumstances. These changes that are done through the courts, when you look at the end of slavery, when you look at women getting the right to vote, these happen because local activists and because local folks have brought up and educated the population so they're ready for those changes. And the courts respond to that public pressure as social mores change. So my question is, what can we do to lay the foundation for the courts to strike down this incredible abusive policy? And I just put it to the entire panel.
The thing is that we need to have a conversation, and it needs to include everybody. And so, like the incrementalists, like you're saying, after we get through the conversation, people can get to the place where they are going to understand that we need a regulated model, and we don't need to send people to prison, and we don't need to punish people.
I asked the panel, given all these facts, is it time now to abandon decrim as a legitimate policy that we should fight for, and then just simply hold out for complete equality with the users and distributors of other drugs, such as coffee beans?
Yes.
I'm also completely obsessed with collecting the references because I'm in public quite a bit talking about failures of drug prohibition. I get challenged. And I get challenged, people say, where are your references? So now I have a disc, it's out front. There are 450 references on that. that are in various categories, the ineffectiveness of policing, the effectiveness of incarceration, et cetera, a donation will get you that disc. And if you ever want to write a paper on this topic, that's where you probably want to start.